Hello everyone, this is Dr. John Makoff. I want to talk about a case I had this morning. Maybe something you guys have experienced yourselves, maybe not, we'll see. So I had a lady come in and a lot of fatigue, some brain fog, memory issues, various things, hard time concentrating. And more recently than not, but have some sleep issues and a few other things. And she came in for multiple things, but this is the part that is important. So for me, I checked her cranial nerves, her brain nerves, with using quantum neurology assessments. And basically, 10 out of her 12 cranial nerves were inhibited. That's no bueno. Right? So I had and she talked about how she'd been staying up very late at night, doing a lot of work, and just getting in the flow of work, and just keeps going at it and little sleep. I had a feeling that I wanted to check out. And there's a concept that was introduced to me by Dr. George Gonzalez, who developed quantum neurology. And it's the concept of digital concussions. And you might ask, what's a digital concussion? Well, I'm going to tell you. So a digital concussion, if you can imagine every screen that you are looking at, whether phone, tablet, computer, has, whether perceptible or not perceptible, flicker. And each flicker, especially from a blue light source, goes through your eyes, from your eyes to your brain. Now, if you can imagine all those micro flickers accumulating over minutes, hours, days, months, years, are little impacts on your brain. So which can accumulate more trauma to the brain, especially depending on how close you are to the screen and how bright the screen is, and a few other things. So I treated her for this type of digital concussion. While there's certain reflexes that I check from a different technique I learned. And when she wasn't looking at her screen, that reflex was strong, normal, intact. When I brought her phone up to her to look at, that reflex went totally inhibited. So we went through treating this, and after we were done, well, the reflexes were better, but also every single cranial nerve except for one aspect of her eye, which I think is from a different thing we had to work on, and it was just one angle of the muscles of the eye. Everything else was strong, challenged it was strong as well, and was better. So I recommended for her to get some blue light blocking lenses, and we'll see where that goes. But yeah, I think that's an important concept, especially with how many kids are out there on their screens, phones, tablets, and some of the things with concussion, besides fatigue, brain fog, difficulty sleeping, can also be irritability, can be a variety of depression, anxiety, headaches, a variety of things. So that needs to be assessed in kids as well, or anybody who's on technology a lot. So I thought that'd be a good thing to, introduce, and hope everyone has a blessed day. All right.